Diastasis recti, why postpartum moms have a mummy tummy, and what to do. After giving birth to her first child, Sarah noticed that her stomach seemed to stick out more than it used to. She went to see her doctor, who told her that she had a condition called diastasis recti. This is a separation of the abdominal muscles that can occur during pregnancy, and it can cause a protrusion of the stomach. Sarah was worried and self-conscious about the way she looked, but her doctor assured her that there were exercises she could do to help strengthen her abdominal muscles and correct the separation. Sarah committed to a daily exercise routine and was determined to get her pre-baby body back. It wasn't easy, but with dedication and hard work, Sarah was able to get her stomach looking and feeling strong again. She was thrilled with her progress and felt much more confident in her own body. Diastasis recti is a common condition that affects many women after pregnancy. It happens when the abdominal muscles separate from one another during pregnancy and do not entirely return to their normal position after giving birth. This can result in a mummy tummy or a bulge in the abdominal area. There are several reasons why diastasis recti may occur after pregnancy. During pregnancy, the abdominal muscles stretch and separate to make room for the growing baby. The rectus abdominis muscles, which run through the middle of the abdomen and are in charge of flexing the spine, are capable of developing this separation, or diastasis. As the baby develops, the space between the muscles may widen, giving the abdomen a noticeable bulge. Several factors may raise the risk of developing diastasis recti, in addition to the physical changes that take place during pregnancy. These include having a large baby, carrying multiple babies, and having a previous history of diastasis recti. Women who are older or who have weaker abdominal muscles may also be at a higher risk of developing the condition. Back pain, bad posture, and difficulty performing specific movements, like lifting and carrying objects, are just a few of the physical and functional issues that diastasis recti can bring on. Additionally, since the bulge in the abdomen may be visible and challenging to cover, it may have an impact on a woman's appearance and self-esteem. Strengthening the abdominal muscles and enhancing general core stability are crucial for the treatment of diastasis recti. This can be accomplished by performing a variety of exercises, such as planks, side planks, and modified sit-ups. Before beginning any exercise program, it's crucial to speak with a medical professional or a physical therapist because some exercises might not be safe for people with diastasis recti. To support the abdominal muscles and lessen the strain on the muscles, good posture and body mechanics are important to focus on in addition to exercise. Supporting the muscles and promoting their healing can also be accomplished by wearing a supportive abdominal binder or using a foam roller to gently roll the abdominal muscles. It's important to keep in mind that recovering from diastasis recti takes time and may necessitate a combination of physical activity, correct body mechanics, and patience. In order to make sure you are employing methods that are both secure and efficient for strengthening and healing your abdominal muscles, it is also crucial to speak with a medical expert or a physical therapist. There are several steps that women can take to prevent or reduce the risk of developing diastasis recti during pregnancy. These include maintaining good posture, avoiding exercises that put a lot of strain on the abdominal muscles, and avoiding activities that involve lifting heavy objects. It is also important to consult with a healthcare professional or a physical therapist for guidance on safe and effective exercises during pregnancy. While diastasis recti can be a frustrating and difficult condition to deal with, it is important to remember that it is a common and treatable condition. With proper exercise, proper body mechanics, and patience, it is possible to heal and strengthen the abdominal muscles, improving both physical function and appearance. Thank you for your time. If you found this interesting, please consider clicking the subscribe button. If you believe we could improve in any way, we are also open to criticism.